I know you've been waiting all day for this.
I
So
have.
welcome.
Thanks for having me.
You may begin whenever you like.
All right. Good afternoon, Chairman Hansen and the members of the Health and Human Services Committee. My name is Alyssa Bish, A-L-Y-S-S-A-B-I-S-H. I have been appointed by Governor Pillen as Director of the Division of Children and Family Services at the Nebraska Department of Health and Human Services. I am here today to begin the confirmation process. I am honored to come back to my home state of Nebraska and join DHHS. Over the last few weeks, I have been welcomed by a team of talented, compassionate, and hardworking professionals. I am humbled to be here today to share my experiences and the journey that brought me back to Nebraska. I grew up on our family farm outside of Aurora and graduated from Aurora High School. For my undergraduate degree, I attended Wayne State College before heading to Missouri to pursue postgraduate education. For the last 13 years, I have volunteered at a Royal Family Kids Camp in Grand Island as a team leader and counselor, coaching over 100 team members as they help foster children build resiliency, self-esteem, and hope through a week-long camp experience. I remain connected to many of the children and youth I served at the camp and continue to invest in those relationships today. This experience fueled my passion for protecting children and led me to pursue a career in human services. I hold a doctorate in communication with a dissertation focused on family communication and resilience for children who are in foster care. My professional and volunteer experience centers around children, families, and supporting a strong workforce. From my first role in foster care and adoption research to my most recent position, appointed by Governor Mike Parson to be the Director of Personnel for the state of Missouri, I have been focused on customer impact and program efficiency. During my time directing state personnel, I supported a 50,000 team member enterprise serving 6.2 million Missourians. I prioritize organizational health and talent transformation for our workforce to recruit, retain, and reward top talent. I understand firsthand the importance of a strong workforce and will ensure that remains my top priority as the Director of Children and Family Services. I firmly believe that children and families thrive when we value our most important resource, the people, the ones doing the work. I am committed to ensuring our staff are well supported and have what they need to provide critical services to families. I bring a depth of experience to children and family services, having worked in foster care and adoption services, strategy and performance, leadership development, and operational excellence. During my time with the Missouri Department of Social Services, I oversaw the Family First Prevention Services Act implementation and executed Missouri's first statewide program focused on older youth and transition planning, which increased in the number of youth served threefold. My career thus far has been marked by action and innovation, two qualities that will help Nebraska enhance the way we serve families. Together with the team at DHHS, I will prioritize prevention and safety, ensuring families have the right resources at the right time to keep children and vulnerable adults safely in their homes. When out-of-home placement is necessary, we will prioritize kinship placements and work to engage families in a clear plan of reunification. We will do this by partnering with our frontline case managers to evaluate our policies and practices, so they have more time to provide support and services. We are only as strong as our workforce, which means Nebraska families depend on us to recruit, retain, and support team members so they can be there for families when they need them the most. Our youth and rehabilitation and treatment centers will focus on their most important task of rehabilitating youth through treatment and support services. Youth and community safety will be at the forefront as we work to engage youth in positive peer, staff, and community relationships. We will continue improving educational outcomes for youth, increasing school attendance, and the percentage of credits earned to ensure youth are set up for success. When youth leave the YRTCs, we will partner with their family, probation, and community services to support a successful transition. Moving back to Nebraska was an easy yes for me and my family. This is where my roots are and where my husband and I want to raise our son. Surrounded by the support of our extended family, friends, colleagues across the state, and strong team at DHHS, I am committed to serving Nebraska families with excellence. I'm grateful to Governor Pillen and DHHS CEO Steve Corsi for their confidence and support. I am excited to serve Nebraska as a part of this administration. I appreciate the opportunity to come before you and the committee today, and I look forward to working with each and every one of you. Thank you for your time, and I'd be happy to answer any and all of your questions.
All right, thank you. I'm very happy about that too. That's great.
Yeah.
I'm excited now. All right, is there anybody from the committee that wishes to say anything? Yes.
Thank you, Chairman.
Senator Eby.
Thank you and welcome. We've met before, but thank you for being here.
Thank you.
I guess the first thing I would ask is, do you really have a black belt?
I do.
Okay, well, I will show you great respect. My question, I guess, gets to be is, how do you keep staff from imposing their values in terms of the effort to try to make sure that we get children where we can back into their homes? But oftentimes, the caseworker has certain values as well. And I think it's difficult to overcome maybe our own perception of how family should be or how life should be. Have you had that experience, and do you have some thoughts about how do you coach your staff to be able to maybe be more accepting, or the parameters are a little wider?
It's a really insightful question. The great thing about DHHS is it really takes a team. So when we do have that frontline worker that is out there assessing families and meeting with families really to understand what's going on in the home, they also have a supervisor that also helps with the case management, somebody who has been in the profession for quite some time. They've seen a lot. And so there's checks and balances with what do you think is the right next step, and then how do we incorporate that team? And then in addition to that, each child that we see has like a family support team. And so there's lots of voices that are speaking into what is best for that family. We really trust our courts, medical providers, community experts, people that know that child. And so I do believe in the power of relationships and that team working together. And the one thing I will say about our staff is even when they have maybe their own personal values, they're all very, very committed to the mission, which is keeping kids safe. And so I have strong confidence that with the team, they're making the right decisions for
Thank you.
kids.
May I have one more question? Thank you, Chairman. I like to ask this of people that are going to be in leadership roles. Have you ever fired someone?
Sadly, or maybe as a blessing, yes.
Okay. Thank you, Mr. Chairman. Thank you again for being here.
My pleasure.
Senator Kavanaugh.
Thank you. Thanks for being here. It's nice to see you again. Can you remind me when you were first appointed to this position?
December 28th is my first day.
Okay.
So I'm, 30 some days on the
Yeah,
job. So
wow.
that's how much knowledge I get.
Right between the holidays too. So you said that you supported a team of a 50,000 member team.
Mhm.
And how large is the team that you're supporting now, that you're charging?
At CFS?
Yeah.
About 2,300, I believe.
Okay. And are you expecting, how many open positions do you have?
Also a great question. We have 369 vacant positions.
Are they similar positions? Are they across all various levels or?
I would guess across various levels, but I could get you more information.
Okay. And what are the plans for recruiting to fill those positions?
So I think in all things, recruitment is really important because we know when we have more staff, we can serve families better. And so we're really taking a strong look at recruiting the right applicant. We don't want just warm bodies filling a seat, but people that really care about this work. So I've been meeting with the team about where our biggest needs are until those positions are filled, how we can look at the work differently to support each other. And so really just focus on getting our mission out there and recruiting the right talent for the right position.
What would you say is your largest staffing need right now?
It's a good question. I'm going to say the front line just because when we have a full, which we're close, we have a pretty good staffing in a lot of areas, but when our front line is fully vetted, we have more people to help do the work, which gives us more time with families.
Okay. And do you have the current statutorily required ratios happening in child welfare?
Yes.
You do?
Yes.
Holy smokes.
I know. I'm ahead of the game.
That's like amazing. So that must not be a huge problem then for recruitment and retention, because I don't know that we've ever been in compliance over the last decade of child welfare ratios. So it's 17 to 1?
For ongoing cases, correct. For investigations, it's 10 to 12. For both, it's 14.
Okay. And so when you say, okay, ongoing is 17,
16, 17, yes.
investigations is 10 to 12, and what was the 14?
If they do both investigations and ongoing, that's 14.
Okay. Great. So you don't have any openings then for the workforce for child welfare?
I
Is
might
that-
have misunderstood your question. We do still have vacancies.
Okay.
For sure. The one that I think is that should be prioritized is that front line, which is doing those ratios that I just mentioned.
Okay. Yeah, any information you can get us on staffing and those ratios would be extremely helpful. Thank you.
Any other questions from the committee? Senator Walls?
Thank you, Chairman Hansen. Hello, how are you?
Hello, it's good to see you again.
Good to see you. So over the past few years, we had a conversation together with Director Green, which was really good conversation. And we talked about the issues that we've had to deal with over the past few years. And just the relationship between the legislature and Health and Human Services agencies. Can you talk about how you would strengthen or what you would do to try to strengthen those relationships? The goal is obviously that we work together to make sure that our kids and our families are safe and healthy. That is the ultimate goal, regardless of anything else.
Mhm.
Can you talk about how we can work together to make sure that we can accomplish that goal?
Yeah, thank you for the question.
You bet.
You stated it perfectly. I would advocate that we're on the same team. I am an ally of this body, and it is your job to help write the laws to protect our kids and families, and it's my job to give expertise on how best we can do that. So I definitely see this as a partnership. One thing that I just believe personally is to believe the best intent of others, and so asking good questions and having the relationship to say, these are maybe some spaces that we need to grow, but here's also what we're doing and like our plan to move things forward. And then also having space for you to share what you're seeing from your perspective, because it takes a village to raise a kid. It takes a village to care about Nebraskans, and all of our perspectives, I think, are really, really important. And so I think starting from a place of trust and relationship is really, really key. And having an open dialogue about what concerns you might see from your seat, and also sharing like, this is what we're trying to do, our plans kind of to move forward, and then to trust the process in some ways to give us time to meet those objectives, because we truly are on the same team. And I'm committed to that with all of you.
Thank you.
Yep, Senator Kavanaugh.
Sorry. Thank you. So sort of a follow-up on just child welfare at large. Before you came to Nebraska or back to Nebraska, the Attorney General issued an opinion in August of last year, stating that it was the authorization of our Inspector General's office and Ombudsman's office was unconstitutional. And while that is purely an opinion, and we still have laws to the contrary, DHHS and other state agencies have chosen to observe that as law. And as such, we as a legislature have had no access to information and data regarding child welfare in Nebraska unless the department has given it to us. I have requested such information, again, prior to your time here, and have not received any of it. What can we expect from you in this role as far as communicating to us any situations that are happening within our YRTCs or any of our child welfare facilities or programs?
Mm-hmm. Good question. So I am committing that, like, we are a partner, as I said previously. I know that has been.
And to be fair, and I know that this is at your confirmation hearing, you are actually out of compliance with the law right now, because the law right now says that our Inspector General should be able to show up at any YRTC facility and be admitted. And those are under your purview, are they not? Yes. So you are not in compliance with state statute. And that is, in effect, you are breaking the law. So go ahead and answer, or speak to it however you want.
Note,
However you would like.
Right now, we are abiding by the opinion of the AG, and the
not the law.
information that we can give you, we will. And then also just acknowledging that the information, we do want to prioritize the protection of our kids and just information that is in a lot of the really private information.
But
that
you are breaking the law currently. For the record, you are breaking the law in honoring the AG's opinion. You are breaking the law. So I hope that you understand that. and that is part of your role here. Whether it was a part of your role that you wanted or not, it is in fact a part of your role, and you are responsible for the fact that your employees continue to turn away our inspector generals, which is in violation of the law.
Noted.
Okay, thank you.
Any other questions? All right, seeing none, thank you very much.
Thank you.
We will take any supporters of the appointment of Dr. Bish in support right now. Anybody wish to testify? Anybody wish to testify in opposition? Anybody wish to testify in neutral capacity? All right, seeing none, thank you very much, Dr. Bish. And with that, we'll take the next gubernatorial appointment, and that would be Dr. Stephen Corsi, CEO, DHHS. Welcome. Welcome.
Thank you, Mr. Chairman. It's good to be here.
And you can begin whenever you like.
Do I need to wait for the light?
Nope, you don't get light.
Don't? Oh, okay. Good afternoon, Chairman Hanson and members of the Health and Human Services Committee. My name is Steve Corsi, STEVE-CORSI. I've been appointed by Governor Pillen as the Chief Executive Officer of the Nebraska Department of Health and Human Services, and I'm here today to begin the confirmation process. I'm humbled to have been asked by Governor Jim Pillen to lead the department and appreciate his recognition of how my background and experience may prove beneficial at this point in time. We have work to do to improve services for all of Nebraska. I'm honored to be entrusted with this responsibility, and I'd like to share a bit about my experience. After high school, I enlisted in the U.S. Air Force and spent 9 years on active duty as a jet engine mechanic. I commissioned with the National Guard in 2017 and currently serve in what I believe is the best job in the military. Our team works to ensure our men and women are medically ready to be deployed to any spot on the globe. When they return broken, physically or emotionally or both, it is my honor and privilege to help make them whole again so they can integrate in a healthy way back with their families and jobs. I hold a doctorate in clinical psychology with a postdoc respecialization in educational psychology. I've worked in community mental health, forensic mental health, inpatient psychiatric settings, private practice, as a school system crisis responder, a school psychologist, and have experience in drug and mental health programs. In 2011, Wyoming Governor Matt Mead asked me to serve as director of the Department of Family Services. I believe when called to public service, there is only one right answer, yes. I held that position for over 6 years. I led 28 offices located across Wyoming and served approximately 80,000 citizens per month. The department encompassed child and adult protective services, economic self-sufficiency programs, juvenile justice programs, and juvenile probation. In 2017, I again answered the call to public service, this time in Missouri. Governor Eric Greitens asked me to serve as director of the Department of Social Services. In that role, I led 218 offices located across Missouri and served approximately 1.2 million citizens per month with approximately 7,600 staff members and a $10.1 billion budget. The Missouri department encompassed all my previous Wyoming services with the addition of Medicaid and long-term care. In this capacity, it was my honor to serve the former governor and current governor, Mike Parson, and to have worked with legislators of both states on meaningful pieces of legislation promoting the well-being of citizens. This past summer, I was asked by Governor Pillen to serve in the role that brings me before you today. Again, there was only one right answer, yes. I believe in the mission and vision of both Governor Pillen and the Nebraska Department of Health and Human Services. I bring to DHHS experience as a behavioral health provider, behavioral health executive, human service nonprofit CEO, and as a previous leader of 2 statewide health and human service agencies. Moving to the great state of Nebraska several months ago was an easy transition from the 2 states in which I've previously served. My wife and I were excited to buy a home and plant roots here in Lincoln. We're proud parents of 2 grown children that both followed in their parents' footsteps. Our son into the military like my wife and me, and our daughter is a mental health provider. Our priorities at DHHS include ensuring care and safety of children, providing Nebraskans with a behavioral health system that both meets the needs of Nebraska and serves as a model to other states, improving staffing and services at the Lincoln Regional Center, and eliminating the developmental disability registry. We will focus not only on meeting the immediate needs of Nebraskans, but also assisting Nebraskans as they move towards self-sufficiency. We will strengthen Nebraska families, ensuring not only safety, but financial self-determination as well. We will improve the timeliness and quality of our economic assistance processing with a heightened focus on customer service. Work is currently underway to overhaul our foster care system. In doing so, we will increase kinship placements and improve timely permanency. We must work to address childcare needs in Nebraska. This will require focused efforts to increase the availability of safe, high-quality early childhood education across the state. There are opportunities for meeting these priorities by using both collaboration and the encouragement of unique ideas. The department's leadership, including Directors Tony Green, Charity Menifee, Dr. Alyssa Bish, Interim Director Matt Ahern, and Chief Medical Officer Dr. Timothy Tesmer, will be instrumental in effecting significant and measurable change at the department during the next several years. It is my honor to be asked by Governor Pillen to lead such an outstanding team and effort, as it is my honor to sit before this committee here today. I echo Governor Pillen's statement. The best part of this job is the people of Nebraska, the people we serve, the people I work alongside with at the department, the providers we work with, but in each case, it all comes down to the people of Nebraska. Thank you each for your time. I'd be happy to answer any questions.
All right, thank you. Are there any questions from the committee? Senator Day.
Thank you, Chairman Hansen, and thank you for being here today. I understand you were with an organization called Epiphany prior
Yes.
to your appointment
Yes,
here
ma'am.
in Nebraska. Can you just tell me about the organization in general, what your position was there, and what your work looked like, and how that relates to, in any way, the position that you're being appointed for now?
Yes, ma'am. So with Epiphany, I worked for Epiphany from, I think it was January 2nd to September 7th. My role at Epiphany was to be an executive leadership consultant, coach, consultant. My background is turning organizations around. That's one of the strengths that I believe that I have. And it was also to work in business development.
So what does Epiphany do then generally? What is their?
Good question, Senator, and thanks for asking. Epiphany is a consulting firm that basically works with primarily government and nonprofit human service firms to find efficiencies and improve operations. One of the strengths of Epiphany Associates is that we used to say was to solve impossible problems, to go where find organizations or work with organizations that had problems that they've had difficulty solving through the years and to help them solve those and improve their operational excellence.
Okay, and you said your last day with them was September
7th.
7th. Okay, thank you.
Yes, ma'am.
Senator Kaplan.
Thank you. Thank you for being here.
Yes, ma'am.
CEO or doctor? Which do you prefer?
Steve is fine, ma'am.
Well, informal senator, we'll go with CEO, Corsi. You worked for Epiphany until September 7th of 2023,
Yes, ma'am.
and that is not reflected in your biography or in your accountability and disclosure forms. Is there a reason for that?
Accountability disclosure.
You have to submit an accountability disclosure of your financials and any
I believe that was for 2020.
2023.
Have those been submitted already for 2023?
You have one submitted, yes.
I-
And it is not there, nor is it in your biography on the website, nor is it in your your personal biography on LinkedIn. And I'm just wondering if there is something that you would like to share with us about why that would be.
Absolutely not. Error in oversight. And with regard to LinkedIn, I've thought for a long time, I need to update that. Correct.
So, okay. And when were you appointed to this position?
I don't know the date of appointment, but my first day on the job was September 11th.
Okay. And
So it was 4
prior
days.
to your appointment to this position, was the state engaged in a contract with Epiphany?
To my knowledge, I believe they had recently signed that.
And do we currently have a contract with Epiphany?
Yes, ma'am.
And are you working with them?
Yes, ma'am.
And what does that work look like?
So Epiphany is working with the department on 2 projects currently. One is in the arena of child welfare or children and family services, assisting CFS in some transformational work. And the other
Can
will
you,
be,
before you move on, can you explain what transformational work
Sure.
is?
sure. One of the things there are a few things that I would point out that have been identified and are currently being worked on. One of those would be trying to look at the numbers of kids who are coming into care and figure out ways to safely and appropriately reduce the kids coming into care. And then of the kids who are in care, the children and youth, looking at ways to expeditiously, obviously safely and appropriately, expeditiously move them toward permanency, whether that permanency would be reunification with their families, which would be the preferred option, obviously, if at all possible, or potentially adoption or some other form. That would be one. We're also looking at reducing the numbers of assessments for caseworkers to have to do with families when they first begin. So one of the things that we have heard, and that is not unusual across the country, by the way, however, our focus is here in Nebraska. One of the things that we've heard as a leadership team is that the people on the ground, the caseworkers, are spending about 40% of their time on paperwork. Well, that's certainly not what caseworkers signed up to do. They signed up to work with children and families. That's where their strengths are. That's where we want them to be able to focus. A few months ago, or a couple of months ago, I think it was 2-3 months ago, something like that, we identified that there were at that time 8 assessments that they would have to go through in an effort to identify the needs of children and families. 8 assessments is onerous, it's bureaucratic, it's not helpful. Now, one of the things that Epiphany focuses on is the needs of the primary customer, not the needs necessarily of the internal or the host organization. So we want to ensure, we being the department, want to ensure that we are working in the best interest of kids and families, not engaged in bureaucratic, unnecessary processes. To that end, we're working to reduce the numbers of assessments, if that makes any sense, and to ensure that we have thorough, comprehensive, best practice, evidence-based assessments, if at all possible. That's on the Children and Family Services side.
You had another one. Go ahead.
On the so we're about to embark in some work on the Medicaid long-term care side, and again, the focus is on ensuring that all Nebraska citizens are well cared for, that the resources are well utilized, and that we're operating as optimally as we can. So,
What does that mean?
on the long-term care side,
Yes.
so we're looking at Senator, we haven't really started that work yet. I'd rather sit back, but I'd rather provide that information forthwith, but not necessarily
Okay.
in the.
So going
in the
back to the child welfare side, unless
Yes, ma'am.
anybody needs to jump in. Okay. So on the child welfare side, the work that you're doing with Epiphany on that side, what is their background in child welfare and what expertise are they bringing to the table as far as the reduction of children coming into care to begin with?
So the CEO of Epiphany, by the way, going back to your previous question about if there was a signed contract, you would have to contact Epiphany. I assume there was a signed contract at the time that I was
Well,
appointed.
My
I
staff
don't
just
know
brought
what
in the
date was.
contract that there was in fact a contract from June of this year, and it was an emergency
Okay.
contract, which is another problem because an emergency contract is a no bid contract, and it is questionable as to why Epiphany required an emergency contract for $10 million, but that circumvents our transparency and procurement process that's neither here nor there for now. So go on.
Appreciate that. Your question, Senator, was about what is their expertise in child welfare
Yes.
or in that arena. I couldn't answer that for them. I mean, they would have
But
a better answer than I do. No, I'm
Okay.
going to give
Okay.
you what I know.
Okay.
I don't know everybody's exact history that is on the Epiphany team, but I can tell you that Kristen Cox was, who is the CEO of Epiphany Associates, was in the Utah Governor's Office of Management and Budget. She was the executive director for a number of years. I don't know what that number is. In that regard,